So this case was, my mentor was also Dr. Guralnik, was mentored this case also. So our case is a 29-year-old man. He's otherwise healthy, that presented with recurrent episodes of fever and productive cough for a couple of months. He was treated with antibiotics in diagnosis of pneumonia with no response. His physical exam was unremarkable, and he had leukocytosis and elevated CRP. This chest X-ray shows widening of the mediastinum and the right hilum, and also an alveolar opacity on the right upper lung field. Then he had a CT. Contrast has CT, you see here inhomogeneous hypodense mass in the mediastinum, in the right mediastinum, that has a mass effect on the vessels and the airways in proximity. And on the lung field, you see this consolidation that we saw on the chest X-ray in the right upper lobe. So the differential diagnosis for the mediastinal mass is first of all, is a tumor such as lymphoma, and for the pulmonary consolidation of pneumonia, and it fits the clinical presentation. So then he went to have a tissue diagnosis from the mediastinal mass, and the diagnosis came out to be Nocardia sciatica. In suspicion of immunosuppression, he had an immunologic workup that was negative, and he also had a brain CT that excluded cerebral involvement of the disease. Then he was treated accordingly, and 9 months later we see here the CT post-treatment that shows near complete resolution of the mediastinal mass. This here, just to remind you, that was prior to the treatment, and this is post-treatment. So Nocardia is a ubiquitous group of environmental bacteria. It's an opportunistic infection that usually affects immunocompromised hosts, but up to 1/3 of the patients are immunocompetent, as in this case, and usually they cause localized cutaneous lesions. Pulmonary infections, most common clinical presentation. The chest radiograph can be very variable, from focal to multifocal disease, nodular to consolidation infiltrates, and also cavitary lesions. Extrapulmonary necrotiosis is relatively common. It could be either by hematogenous spread or contagious spread of necrotizing pneumonitis into the near structures. Nocardia sciatica is a rare subtype. Only few cases were reported in the literature. One was presented as mediastinal mass, and the other was immunocompetent. So it's a very likely subtype to cause this presentation. So our case is unusual because, first of all, it's an immunocompetent patient, and it was presented as a mediastinal mass and a very rare species of Nocardia. Thank you.